All right, so it's pretty natural for any of us to get the blues every once in a while, but what if those blues just don't seem to go away?
Depression affects millions of Americans, but the treatments can have varying effects on any individual. Furthermore, depression can affect men and women differently. The good news is there is a potential solution out there for those who may not have seen positive results with other therapies. Susan Angel joins us from CNS Healthcare with details of how they're getting to the bottom of the condition and how you might be able to take part. Now, we know everybody knows what depression is, but how can it be different or recognized in men and women?
The primary issue with men is it's often under-recognized and undertreated. Men oftentimes are uncomfortable discussing their feelings and emotions, so oftentimes they just tend to stuff them, whereas the women are more open in expressing their symptoms and then will seek treatment.
That makes
So
a
for
lot
people
of
like
sense.
me that wear their heart on their sleeve and can cry at the drop of a dime, and we're okay, hopefully.
Hopefully.
Or maybe then we go the other way.
Your treatment could be more recognizable,
Right.
perhaps, if
You know,
you're
what
crying
are-
all the time.
What are some of the signs that we should be looking for if somebody is going through that?
Well, depression, it's a broad description of symptoms. You know, oftentimes you feel unhappy or sad. There's problems with sleep or appetite, and those are kind of general things. But more specifically that you need to look at with men in particular are feelings of aggression or excessive rage, abuse of alcohol or drugs. You may even notice violent or abusive behaviors towards a spouse or children. They may also exhibit a disinterest in sex, or they may go to the other end of the spectrum and engage in some risky behavior. Other things men may do are over-involve themselves, whether it might be sports or work or things of that nature, or other risk-taking behaviors like gambling or reckless driving, other things.
So any of these things that you're talking about could be a sign, and then what if you recognize that in somebody? What should you do to get past that? What's the next step?
Certainly, well, as a family member or spouse, I mean, encourage them to seek out assistance. And men, they might need some prompting in making that initial step. But the primary thing they need to do is reach out to a healthcare provider who can, you know, accurately diagnose them and, you know, provide them with some treatment recommendations.
Because what could happen if something isn't done? I mean, it could be pretty bad.
Well, one thing particularly scary is the fact that men are 4 times as more likely to commit suicide than women are. And of course, that's the worst outcome you can imagine. But also, I mean, there's impacts on relationships, impacts on work, and just overall, you know, their success in life can be impacted significantly.
So that leads us to what you guys do. What kind of trials do you guys have right now, specifically for men or anybody that may be experiencing depression?
We've got some really interesting studies with depression going on right now, both for men and women, but there's a variety of them. Some for people who've never been treated before. You have the opportunity to come in and be evaluated and diagnosed and then possibly participate in a trial. And then for other folks who have been diagnosed with depression where it's a recurrent situation, there's other avenues to pursue there, because some of the medications we're using are really exciting. It's nothing like we've had in private practice for many years, and so these new compounds could offer a good solution for folks.
There could be help out there. Now, how can someone go ahead and get themselves involved in a trial?
It's just as simple as making a phone call or either, you know, visiting our website where you can schedule an appointment for an initial evaluation. And of course, that appointment is of no cost. You don't need health insurance. And you'll see either when you come in, myself, a therapist, or one of our nursing staff, and what they'll do initially is evaluate you, look at your symptoms, your medical history, any medications that you're currently on, and then review the trials that we have going to see if you're a good fit. And then if that all looks like a good outcome, then we'll schedule you for a screening visit so you can get involved in the study.
Okay.
And this really is a familiar feel. I mean, we're looking at the practice here. I mean, it's just like going to a doctor's office, right?
Absolutely, and I can't say that there's anything different other than you might get, you know, more extensive evaluation than you would in your primary care's office. You know, there's definite time allotted to understand what's going on with you and to make sure physically you're stable so that you can participate in a trial, but it's good care.
And then finally, aside from the fact that this could really help somebody, I mean, that's compensation enough,
Certainly.
right? Is there compensation on top of
There
that?
is. For people who actually enroll in a study, you are compensated for each visit that you complete, usually no less than $40 per visit. So aside from getting the good workup, you know, seeing a clinical team regularly and helping the community, I mean, you also get a little bit in return.
Well, that's
Awesome.
great. Thank you so much for being here, Susan. That's great information, especially for people who are out there and maybe looking for help.
Certainly. Thank you.
Absolutely. Thanks to Susan for her insights, as well as CNS Healthcare for sponsoring this segment. To find out if their trial is right for you, call 904-281-5757 and make an appointment for a free 30-minute evaluation session. Or you can also log on to their website at cnshealthcare.com.